Hi, we are at difficult times now. However, we have to adapt to the new situation and find a workable way and move ahead. Your doctor, that is myself, Dr. Jacob Thomas, is available in the clinic between 8:30 a.m. to 12:30 p.m. every day from Monday to Saturday and on Sundays from 8:30 a.m. to 10 a.m. There are all possible precautions that we are taking nowadays in order to prevent the transmission of COVID infection. All of us are in proper protective equipment with caps and masks and goggles also sometimes, and we use hand sanitizers. However, we require your cooperation also. So these are some of the instructions that we have made. We request you to follow these instructions. One, you can call this number on your screen when you want to take an appointment. We insist that you take an appointment because we try to space two patients, the time interval between them, so that there is no crowding in the clinic. Secondly, when you call this number, you give your details and you tell them the medical problems, current and the past medical problems. You need not get the entire previous file to the clinic, because if too many people are handling your file, that's also a way in which COVID can spread. We request that you take images of all the important reports, make a soft copy folder of that and send it via WhatsApp to this same number which is there on your screen. Now, once we have all the reports, then we will give you a call and Dr. Jacob, that's myself, will do either an online video consultation, or we may insist that you come to the clinic at the appointed time. Now, when you come to clinic, only the patient is allowed to come inside. The relative will have to wait outside the clinic, preferably outside the society gate. The instructions for the patients are, when you come in, we will give you hand sanitizers. Properly wash your hands with the hand sanitizers. You should put a mask on your face when you have come to the clinic. You should not be handling the mask again and again, because you touch some surface and then you handle the mask, you can infect yourself. Then you should seat yourself in a place where nobody else is sitting. There should be proper distance between you and somebody else. Finally, when you sit in our clinic, or when the time that you are in the clinic, you should try not to touch different things. Don't touch the furnitures, the chairs, the handles, etc. That is good for you and good for others also. Now, once the details are taken, doctor will take you inside his cabin and will examine you and will take the detailed history and give the appropriate treatment. And at that time, we will call the relative who is come with the patient. We will call through the phone to the relatives, and in front of the patient, I will talk to the relative and give all the details. That's how we have to do, so that the clinic is not crowded. This will protect you, this will protect your patient, this will protect me and my staff also, and also the other people who are coming in the clinic. If the problem is not very severe, we insist that we do an online consultation. For online consultation, again you call this number on your screen and take the appointment. Tell your current problems first, then send all your reports via WhatsApp in a soft copy folder. Then we will call you via a video consultation, a WhatsApp video. Then I will consult, I will give the necessary treatment, and I'll send a prescription via the WhatsApp. And if your patient is not clinically that sound, we insist that you don't come up to the clinic. You wait in your car down on the road itself. We will come down, we will examine the patient in the car itself, and then we will come up and give the necessary prescription. When your patient is in the car, preferably all the windows and if possible all the doors should be kept open. The more ventilation there is, the less chances that the patient as well as we are protected from COVID infection. So I hope you will follow all these instructions. This is important to protect all of us from the COVID infection, and at the same time we should be able to treat COVID as well as any other. Especially if you are having fever or cough or breathlessness, and that to a recent onset in the last 5 to 15 days, it is better that you do not come to the clinic, and we should do the first consultation online. I will examine all the history details on the online consult, the video consult itself, and I'll send you the necessary investigations and treatment that is required, and I'll follow you up on a daily basis via the WhatsApp consult in itself.